offices, I guess.
Yeah, just by necessity, doctors have asked us to be close to them so they can refer us their patients. So we now have 5 offices in the Bay Area. Our main office is in San Jose, but we have locations in San Ramon, in Los Gatos, and in Santa Cruz. So we'd like to think that we're in an office close to you.
Okay, good. I want to thank you so much. You're going to wipe out sleep apnea in that area?
We hope to make a dent.
Okay, good. Thanks again.
Thank you so much.
You've been watching The Wellness Hour. I'm Randy Alavarez. For now, I wish you good health. So what about the people that have already been diagnosed with sleep apnea? They have a CPAP, but they're one of the 50%, as you say, that may not be able to wear it. They don't like it. What's the procedure or process like in your practice? How soon will they know if they're a candidate for one of these appliances?
Sure. Their initial exam is about an hour. Okay, so when they come into our office, they're handed an iPad because everything that we have is digital. We'll have a lot of their information already uploaded, including their sleep studies and other things that we can get from their doctors. And then when we step into the exam, we actually want to make sure that they're a good candidate for this number 1. Okay, so I'll start with discussing, what their chief complaint is, what is their problem, why are they here, why can they not tolerate the CPAP machine, and what are they looking to really address and improve in their life, whether it's energy levels or snoring or other things. And then I'll start with an exam. I want to make sure that they have healthy teeth, healthy jaw, and that they can comfortably use this device with minimal issue.
Okay.
Once we do the full exam, the comprehensive exam, and I want to make sure they're a good candidate for this, then the patient and I will actually sit down and determine out of the 140 different devices, which one that we decide together they're going to be most comfortable with using, right? And so once that's decided, my insurance coordinator will come in, we'll review the coverage with them, all that will be pre-established before they come in. We'll review their estimate of their out-of-pocket cost, and then if they want to start treatment, it's just a matter of 10 or 15 minutes, taking impressions of their teeth, very accurate models, and a registration of how their teeth come together. And then it's a 3 to 4 week process to make the custom device.
Then they come back and...
They come back, and it's about a 30-minute appointment after that. They come back, they get fitted for the device. We go through all the instructions on how to use it, how to clean it and maintain it, making sure that it's going to last for at least the 5 years that we say it's supposed to last, right? And then we give them some basic instructions, and we send them off to get a good night's rest, right? We have 2 or 3 follow-up appointments after that to make sure the device is comfortable, it's adjusted correctly and effectively. After which we refer them back to their physician for another sleep study to objectively make sure that it's working.
So how does somebody get coverage? How do you help them with the coverage as far as medical insurance or Medicare?
Yeah. One thing that I wanted to establish when I started my practice was that we wanted to work with insurance companies because it makes it easier for patients. Okay. So we are contracted with many, many insurance companies as well as medical groups. So it just makes the process that much easier for patients. When they come in, we should have that information already ready up front, and we are able to give them a more accurate estimate of what their insurance coverage will be.
Is HMO, PPO?
Both, yeah. Both
okay.
HMO, PPO, as well as Medicare. We accept Kaiser insurance as well. And we will work with your doctors and your insurance company to get you approved and get you covered so that you can get the treatment you need.
So what about over-the-counter sleep or anti-snoring devices that we hear about through ads and things like that? Do they work? Are they effective? And what are your thoughts?
They can work for some patients, but really they carry a much lower success rate than these custom-made devices, and research supports that as well. The main thing I hear from my patients is that the device just doesn't stay in. It often falls out. Because can you imagine you're making one device that's supposed to fit everybody's mouth? It's just not going to happen, right?
Okay.
A matter of fact, I just had a patient who came in yesterday. True story. Larry, by the way, his name was. And he came in bringing a temporary device in that he just couldn't use. And he was asking me, Dr. Shah, can you do anything better for me than this? And I said, absolutely. So we were able to get him into a much more comfortable, custom-made device that hopefully will be a lot more effective for him.
Let me take a look at that little. Now this is this is the one you use. And I don't know if they could tell me, but this is very small.
Yeah.
I've had the over-the-counter in my hand. Yeah. This is smaller than that and much lighter.
Yeah, absolutely.
So
it's because this is custom made to fit your teeth only. It's not going to fit anybody else. So
is it like bleaching trays in a way?
Yeah, in a way it is.
Could you put bleach in there?
It's not much thicker than bleaching trays. No, I wouldn't do that.
Okay, all right.
I wouldn't put bleaching trays in it, but it's not much. I wouldn't put bleach in there, but it's not much. It's not much thicker than bleaching trays. Really, that's all it is. Which with some kind of connector or hinge on the side that allows the jaw to be adjusted to 1/10 of a millimeter, so that we can take them not to the farthest position, but to a comfortable forward position where it's also effective at treating their sleep apnea as well as their snoring.
Okay, now some of these over-the-counter, I've talked to some doctors anticipating this interview, that some of these over-the-counter remedies can move teeth.
Yeah, absolutely.
They can, and so the custom devices.
Yeah, the custom devices can as well.
Okay.
But I think the difference here with the over-the-counter devices is that there's no one managing the patient's care, right? So you're getting a device, you don't know what it's going to do to your teeth, and if it does something, who's going to help you with that, okay? And you don't know how effective it is. So is it really helping you breathe better? Is it really helping your snoring or your sleep apnea? You have no idea.
Now, I'm not trying to side with you, but because I've had somebody on the show where they made one of these devices, they boil it in water, so you only get one position.
Exactly.
And you're saying that the success of your center, and I'm not putting words in your mouth, but because you do this full time, you're able to, there's a lot of adjustment, or at least 2 or 3 times to adjust this to make it right.
Yeah, absolutely. We want to follow up with our patients at least 2 or 3 times after they get the device, because this isn't a guessing game. We're not just putting the jaw randomly where we want it to be, okay? It's really finding the optimal position for the patient. I call it a sweet spot, right, where their breathing is better, but yet the device is very comfortable. So it's finding that position takes time, right? We want to get feedback from the patient. How are their symptoms improving? How does it feel comfort-wise? What is their spouse sharing in terms of in their feedback on how the device is working? So we put all this information together, as well as we have in our office, in real time, we can measure the patient's airway using a machine with sound waves. It's kind of like sonar technology. The machine emits a sound frequency that reflects off of the soft tissue, and we can actually measure the size of the patient's airway in real time while they're sitting there in the office with the device in their mouth, and we can compare before and after results of how much this is opening up their airway and allowing them to breathe better.
So what are the options that patients have when it comes to sleep studies to get, I guess, a number on how many times they're waking up every night?
For the longest time, it was that you had to go into a sleep lab, is what they're called. Literally a doctor's office that's set up like a hotel room, where you sleep overnight for one night. They hook up 30, 40 wires to your body, and they measure your quality of sleep. Well, now technology has advanced in such a way where you can do that same study with a lot fewer wires in the comfort of your own home. It's a lot more comfortable, almost as effective. It's about 85, 90% as effective. And it's covered by most medical insurances as well. So patients feel like, well, I'm getting a better quality of sleep in general because I get to sleep in my own bed. I get to do it on my own schedule, on my own time. We can measure and record more nights, and it still gets read by a board-certified sleep physician. And these tests are as small as your iPhone, really. These machines, as small as your iPhone, you can wear them around your forehead or your chest area, and you go to sleep with it, and it's just a matter of turning it on and off, and we can get all the data right off of that.
So snoring, you also treat snoring. It's totally different than sleep apnea?
It's similar. Snoring is the first symptom that we look at when we want to determine if somebody has a likelihood of having sleep apnea, right? If you're snoring, you have to think, why are you making that noise? There's some kind of narrowing in the airway to cause the tissues to vibrate that lead to that really loud noise that no one can tolerate. So if you're snoring, it may just be snoring, but we want to test you to make sure that you don't have apnea.
Are they easy to treat, the snores?
Absolutely.
So snoring goes away?
Absolutely. I'd like to think that snoring is one of the first things that we can eliminate. So we're usually able to get rid of it completely, just with a simple mouthpiece.
So what should somebody look for in someone that's going to be treating their sleep apnea, especially if they're a dentist? I know you're lecturing tomorrow, I guess for the next 2 days for 16 hours on this topic to other doctors. But what should they ask of their doctor?
It took me almost 2.5 years just to become board certified in dental sleep medicine. So it's not an overnight thing. It's not something where someone takes a weekend course. You necessarily want to go see that person. You want to be careful that they have the training that's necessary, because there's a lot to this. Not only is it about the insurance coverage and everything else, the logistics of it, but also the expertise in the treatment itself. There's over 140 FDA-approved devices out there. So it's really determining which one's best for you. It's determining, are you even a good candidate to begin with, right? Because this is not for everybody. You don't want to be getting into something where this is not even going to work for you to begin with.
Yeah.
Don't waste your time or money, right? And then knowing in these devices, they can be adjusted to 1/10 of a millimeter. So how much to adjust, how fast, where to stop, what's the most effective jaw position to improve breathing, right? So that we can treat your sleep apnea and snoring. And then also communication with your doctors, right? So making sure that the device is adjusted to the right position that's actually affecting and improving your sleep apnea so that your apnea is reduced.
So to do this right, and I don't want to put words in your mouth here, but do you have a bit of a bias that you should look for someone that this is all they do?
Yeah,
they're not doing like crowns and bridges most of their day. Well, dabbling in this, that they should do this full time.
Yeah. One thing I established early in my career was that if I was going to do this, I had to do it full time. Because I was doing all the other stuff, the crowns, the bridges.
Because of the adjusting that's involved? Is that why? Is that what takes up most of the time?
Yeah,
the follow-up visits?
Absolutely. You know, to do this right requires a lot of follow-up care and make sure that these devices are comfortable and that they're effective. They're adjusted to the optimal position. You will not believe how many patients come in to see me that have already seen dentists that do this, but never received the follow-up care, were never treated correctly, never received the right device, okay? So they want to believe this works, but they're just frustrated with their prior experiences. So they come in to see us because this is all we do. And I'm board certified, so we can provide that level of expertise. And they know I'm going to communicate with their doctors.
Okay, and you take, Medicare, and HMO, PPO insurance.
Yeah.
And you're on plans? I mean, you're on their medical plans?
Correct. I'm contracted with many medical insurances, and I'm part of many medical groups. So we work very closely with their insurances and their doctors to make sure that this is covered for them.